Okay, welcome to tonight's first community lecture on GI cancers. Tonight's topic is on colon cancer screening. We're fortunate to have two speakers tonight on this topic. The first speaker, Diane Nathaniel, and the second speaker, Carlene Lawrence. I'll give brief introductions before the speakers will give their talk. You're actually hearing from the moderator, Laura Martella-Rooney. I am the Director of GI Research and a Research Assistant Professor of Medicine at SUNY Downstate. I want to thank our sponsors for this event, Cold Spring Harbor Laboratory and Northwell Health. And I also want to give a special thanks to Pamela Straker and Lakia Maxwell from the Brooklyn Health Disparities Center, as well as Betty Zhang from the Center for Community Health Promotion and Wellness. So I'm going to stop sharing for Diane to go ahead and share her slides while I give a brief introduction. So Diane Nathaniel is a native New Yorker, born, raised, and resides in Bedford-Stuyvesant, Brooklyn. She received her bachelor's degree in social science from the College of New Rochelle School of New Resources, and also a master's degree in school counseling from the College of New Rochelle. She currently is a New York City Department of Education school counselor for Public School 11, PS 11. She has gone on to receive advanced certificates in family and mental health counseling from Long Island University, as well as a recent advanced certificate in public health from our own SUNY Downstate. I'm not going to give you much more information about her story because I'm going to give her the time to tell her own story. Diane, you want to take it away?
Okay, sorry about that. I lost my mute button on the screen. I'm so sorry. Good evening, everyone. Thank you for inviting me. I am humbled always when asked to share my story and to participate in any roundtable, any community lecture, discussion, anything about raising cancer awareness, specifically around colon cancer and the screening and prevention methods that could save all of our lives. I'm especially proud to be an alumni of Downstate, so I'm always happy to do whatever Laura asked me to do, or Dr. Straker and Lakia. So I am in good company, along with Carlene, who I've presented with several times before, on behalf of Betty, who always invites me. So I am truly grateful. So tonight I'm going to just start with a disclaimer. They are working on our public school building. Of course, they could not complete this during the summer when there were no people here. So if you hear drilling, please, I am sorry. I purposely stayed here not to go home and hear drilling, and here I am. So I will do my best to talk over it. All right, so next I'm going to show you a photo, but right now I want you to process that I'm going to show you a photo. Take a look at it. If we were in person, I could be more interactive with you, but I want you to think about what you see. And then I'm going to just say thank you in advance for allowing me to share my story. All right, so just look at the photo. And I guess in the chat, you could tell Dr. Rooney what you see, or whoever's managing the chat. You don't have to respond to me or anyone. So I want you to know that in that photo, most people tell me I don't look, I look nice, the scenery's beautiful, my hair looks great. And it's not me being vain, but it's for me to show you how silent GI cancer is, because in that photo I had cancer and I had no idea. That photo was taken August 2013. I received my cancer diagnosis on March 7, 2014, at the age of 44, on my son's 12th birthday. This year we celebrated his 19th birthday and 7 years Ned for me. No evidence of disease to date. All of these people are important to me. Consider the important people in your life when you put off your next doctor's appointment. So I'm a stage 3 colon cancer thriver. I am a wife. I've been married for 28 years. I'm a mother of 3 children. And those folks are my nucleus, my core. And so when I think about not going to a screening, not going to an appointment, I have them in the forefront of my brain saying, you know, I don't want to leave them behind. And so it makes me more inspired to attend my appointments. So the next time you think about putting off any screening, not just your colon cancer screening, think about the members of your core, your nucleus, the people who you love the most, what that could do to them. Sometimes there's an indirect link to the real problem. So I share this part of my story specifically because I didn't find out that I had cancer the way we're trying to promote screening, right? I was under the age for normal routine screening for colon cancer. Back then it was age 50 and I was 44 at my diagnosis. So no doctor was really looking at me for colon cancer. So 10 years prior to this diagnosis, I complained about most of the symptoms I'll show you in a few of the slides, but we were testing me for everything else because I wasn't of the age. So a pre-surgical testing for a labrum tear in my right shoulder is what indicated that I had a low blood loss issue. My hemoglobin was very low. It was between like digits 4 and 6. And that made that doctor say, we're not gonna do surgery. We're gonna hold off for 2 weeks. We want you to see a hematologist. Even though it's not a bloody surgery, you don't even have enough in your reserve and you're kind of young for that. So thankfully for him pulling that and saying, you know, we're gonna send you someplace else to have your blood checked. Otherwise I may not be here today because after those 2 weeks of postponement, I wasn't gonna do this test. And I was like, oh, maybe I could just do therapy. And so here are some of the symptoms that you should be concerned about if you're experiencing them. And these were all symptoms that I complained about at the age of 34. Chronic constipation, severe fatigue, unintended weight loss and gain. And I was told that was attributed to me having a baby and breastfeeding, by the way. Chronic bloating and indigestion. Rectal bleeding was the last stage of the game when I ended up having to see a GI doctor. And then my low hemoglobin that I told you about between numbers 4 and 6. And even though I saw that hematologist and even though my levels were low, he still never tested me for cancer. I learned that recently after like interviewing him. So my treatment involved surgery, a right hemicolectomy to remove the cecum portion of my colon. That's where my tumor was located. And at the time it was 5.7 centimeters. At the time of removal, it grew, it was aggressive. It was 7.5 centimeters. 14 lymph nodes were removed, of which 4 were affected with cancer. My appendix were removed, 12 rounds of chemotherapy, 8 months, every 2 weeks, 48 hours every 2 weeks. And so I don't want anyone to go through any of that. So if you have the ability to get screened before any of this, if you are age 45, please go have the screening. Go have the screening. 90% of colon cancer cases are preventable through screening. Here's a slide about polyps and what they are and where the cancer begins. So I was never screened for a polyp. It takes polyps between 7 and 10 years to turn into a cancer. And it's a result of a genetic change in the cells. I won't get clinical. You can kind of view this slide on your own and try to process it. What was interesting to me was that polyps are found in about 30% of the adult population over the age of 45 and 50, yet I was 44. And there are so many more cases of younger people becoming affected by colon cancer. Men and women of all ethnicities are at risk of colon polyps and colon cancer, but I forgot to put the numbers in. I'm sure Carlene will cover it. But the percentage for Blacks is enormously higher we don't have we have the lowest survival rate as well. So in addition to being one of the cases, then we also have folks dying at a higher rate than every other ethnicity from this cancer. A preventable cancer. Factors that can increase the risk or rate of the polyps that grow are related to our diet, our lifestyle, older age, which they're going to change, right? Because I'm not of older age, gender and genetics or hereditary issues. And out of this, mine was not hereditary either. So I want everyone to know that that screening that you take, definitely do the gold standard, which is a colonoscopy. There are other treatments, there are other screenings that you could do, but the colonoscopy is the gold standard. If you do a FIT test, which is the stool test that you would do yourself, once you send it in, if they find blood in your stool, you'll have to go in for the colonoscopy anyhow. So it makes sense that if you're 45, you are eligible for this screening now. And here's some of the important lifestyle factors predisposing us to colorectal polyps and cancer. And I know most of this list, you're all going to look at it and say, dear Lord, that's me. Am I saying you'll have cancer if you meet this criteria? No, I am saying you are at risk. And it might be wise for you to seek out a GI doctor, gastroenterologist sooner than later, just to make sure you're on the track of staying healthy. So we know that smoking, excess alcohol ingestion, drinking too much alcohol. Well, I guess, yeah, we all know that that's different for everyone. Not exercising, being overweight, eating a lot of processed foods and too much red meat instead of a mostly plant-based food plan. I definitely had to change my diet. Processed foods was a thing for me. I was a mom on the go with 3 small kids, 3 different schools, right? It's the life of an average New Yorker, eating, you know, sandwiches from the deli. I used to love me some Nathan's hot dogs. And sugar, I don't know why sugar is not here. And I drank a 1 or 2 liter Sprite daily. Like my office that you're looking into right now was filled with Entenmann's butterloaf cakes. Let me tell you, I was a hot mess. I had no idea that sugar feeds cancer, and no one was testing me for it. So I didn't think that that was an issue. I actually had a cold that wouldn't go away that led me to the doctor to start this process after the shoulder surgery. And during that time is when she said, you know, would you mind if I take you to some of my physicians, and no one should be doing iron infusions for an entire year. So the hematologist said I had low iron. He put me on iron infusions. And that just didn't help the hemoglobin to raise its levels. After doing that, I had a 2-week span before seeing a GI doctor. And unfortunately, I had rectal bleeding at that point. So that was one of those things that made me stop and pause. And later on, finding out after treatment that the diet has everything to do with it. Other factors include being Black, everybody, having a personal history of colorectal polyps or cancer, and having a personal history of inflammatory bowel disease, Crohn's disease, or ulcerative colitis, or primary sclerosis cholangitis. So all of these, if there's some sort of predisposed history that you know about in your family, one of the things as African-American families we don't do is talk about health history. Please start asking questions.
Ms. Branch, please.
Sorry, I'm at work.
Start. Have students pack up so that they can dismiss outside. Ms. Branch, please supervise pack up and the dismissal routines on the Waverly.
My apologies. It's the life of a public school after school's dismissing. So again, please have these conversations with family members about your medical history. What to expect from the test. I think this is the part where most people are apprehensive to going for the exam because they're afraid of the prep. So there are different types of preps. Again, I'm sure my girl Carlene's gonna go over those, but I do the Gatorade prep, which is 10 times better than that Go Lightly that they make you drink this huge jug of. But I promise you it's worth it. You'll lose 4 to 5 pounds without having to starve yourself, and it's the best sleep you will ever have. Most importantly, it is going to be the gold standard to detect the cancer or any polyps that could be cancerous and remove them during the procedure. So that's the beauty of this test as well. There is no waking up and coming back to remove the polyp. It can be done while you're in the procedure. But I have to tell you that because 10 years prior to being diagnosed as a Black woman, when I complained about all these things, I felt unheard. I felt dismissed. I felt not taken seriously. Women, we bleed from two places. So when my cycle was coming twice a month, I was just told, oh, your blood loss is probably from your cycle. There was no testing to make sure that was it. If my hormones were changing, if I was premenopausal, none of that was checked. Again, because they were so focused that I wasn't of age to be affected. I felt like no one was listening. I complained for 10 years prior to this diagnosis. And so for anyone else listening that is in the medical profession, cultural, environmental, and social determinants must be considered and practiced if you truly want to reach a patient. It is essential in a patient's decision to follow up with a health issue. At any point, I could have stopped advocating for myself or going in to get some help. And at some point, I believe I did. I got frustrated being unheard, dismissed, and not taken seriously. So I just know that the way patients are treated has everything to do with their follow-up. And for us to take responsibility as well of our health, pay attention to your body and trust your gut. When we feel like something is off, it usually is. Tell your doctor the truth. Many of us go in and we do not tell them all the symptoms. So doctors can only address the symptoms you tell them about. So it's important that you're truthful and you say, you know, how long you've been bleeding. It's not going to make it any better if you don't tell the truth. So find a doctor that you're honest with, that is honest with you. How has my life changed? Well, I have long-term side effects. I have neuropathy from chemo in my feet. Still get mouth sores occasionally. Leg and foot cramps are almost like twice, 3 times a day, specifically when sleeping. And I'm infertile. You know, I was only 44. Yes, I have 3 children. No, I didn't plan to have any more. But when the option has been snatched from you and you don't get to make the choice, and it's inhibited because of cancer, it is way more difficult to kind of digest and accept. And my diet has changed. I recently completed the 21-day plant-based powered jumpstart for Brooklyn's Black community leaders at Downstate. I want to again thank Dr. Straker invited me into doing that. And it was also sponsored by our borough president, Eric Adams, and it was spearheaded by Ayana Basson. And it was amazing. It was amazing. I met some awesome people and I have implemented plenty of that regimen into my diet, which has been definitely great and has lowered my cholesterol and has improved my, you know, my eating habits have improved, especially being back at work. I can definitely feel my energy level increasing. So there are benefits to a plant-based diet. And then all the things that cancer did that were negative, some of the things that cancer was positive for me in a way where I was able to create what I didn't see after treatment and in survivorship. I felt like there was no coordination of care. I was told I could eat anything I want. Well, we know that was a stupid comment if eating what I wanted got me in this predicament in the first place, right? And then there was no nutritionist. There was no, I had severe headaches and migraines. There was no neurologist. There was no, here are the things if you experience, these are the people you need to see. So we created Beat Stage 3 in an effort to do that. Cancer is one of those diseases where you look at a person and you can tell they're sick. And I wanted to give everyone a chance to get their inner and outer beauty back and motivate cancer fighters and survivors to share their stories as well. I became an advocate with American Cancer Society. And most importantly, I went back to school at Downstate to help get a degree and some background in, to get a degree to help share information about disparities and what exists in the healthcare system, but also to make a change. And here's how we can reduce the cancer burden. Start taking care of our own selves. Stop waiting around until we're unwell. Be honest with your doctor. Notice when your body's feeling different. Take responsibility of your diet and food habits. Develop a network for exercise and physical activity and a routine for self-care. And the medical community, I love you guys so much. Without you, we couldn't survive. Continue the research. Talk with the community and ask them what they need and lack. Often we give solutions for a problem that doesn't exist. Know the community you serve and meet them where they are. Consider a person's environment, what's in their control versus what's not in their control, like food deserts. build health literacy through education, refrain from shaming people for being sick, improve healthcare messaging, work with community partners to build health equity, and lastly, educate yourself on cultural responsiveness and inclusivity. President Barack Obama says we're all 1 degree away from cancer. So today, if you didn't know anybody, I'm your one, and I don't want you to be one. If you want to support me at Beat Stage 3, here's our information. Thank you for your time this evening, and I hope this information helps to save a life.
Thank you, Diane. That was really an excellent talk. And I'm very thankful for having met you a few years ago when we were organizing our annual Cancer Health Disparities Symposium, and you agreed to give, to basically tell us your story and help us really improve, the message about colon cancer screening, as well as, specifically these changes where now the recommended screening age is 45. This is a critical message to get out. Lakia, are there any questions in the chat for Diane?
There are currently no questions.
So I guess my question for you, Diane, is with regard to Beat Stage 3, how have you been able to keep, because you're juggling so many things, how have you been able to keep things going with regard to Beat Stage 3 and keeping that message going out into your community?
Wow, we created CAPE events, Cancer Awareness Protects Everyone, and we've had small pockets of events prior to COVID. So once there was, COVID-19, it's difficult to do events virtually. Everybody was doing something virtually, but honestly, the way Brooklyn, we're an event-driven borough. We love to eat, we love to drink, we love to socialize and network, and so I created Her Talks instead, which was a talk show, Health Empowerment Reimagined, where I was able to invite doctors now on to speak along with a survivor of a specific illness. And it wasn't just cancer, because we covered heart disease, we covered blood clots, and we did cover colon cancer and prostate cancer. And I had a male in addition to a woman, because our men would go online before they go in the office. And it has been amazing to hear from some of the men who went to get their hearts checked out, from all of the men, at least 4, went to get a colonoscopy and had a prostate issue. So that's what's rewarding to me, that you go and you get the exam and whatever was found is removed and you're safe now. But I think that we've just developed, we're going to launch our Love You baskets for chemo patients. So that's like our biggest, newest thing, because folks could not get out. When you go to chemo, you're cold, your hands are cold, your feet are cold. You can't, when you're done, especially if you take 5FU, when you breathe in air, it closes your throat up. So I didn't have a scarf. So we created scarves, we did new masks. We've got partnership from cosmetic companies, which has been really dope. So we'll have like nail polish that's toxin free, vegan lipstick, and our eyebrows and lashes fall off. So just a way to give people their beauty back. So we have been able to do that, sustain folks with teas and just comfort, because it's a time of discomfort. And then also still raising awareness. American Cancer Society has just created the Black Volunteer Caucus. So I am super excited to have been tagged in to be one of the first 12 members. And that is going to be Black people, advocates, liaisoning with American Cancer Society for policy. So that is the biggest deal, the policies that exist. So in food, in housing, and all the things that affect how and when a person goes to seek out help.
Yeah, no, I think you're definitely right in that policy is really the only way we can make real change and improve health equity. So I'm so happy that you've now entered into that area of empowerment, because I think that that's clearly the next step. One other question I had was regarding, I think we all know males are less likely to go to the doctor. And so I believe you had designed a cognac and what was it? Cognac and cancer.
Conversations, yes.
Yes. So I think, things like that, where you get a little creative
Yes.
to draw in the, our male counterparts.
Yes. Yes.
And yeah, if you could just speak a little to how that event, turned out.
Well, yes. So we partnered up with BK9, which is an amazing restaurant right on Fifth Avenue in Brooklyn. We had to postpone it, but we're still going ahead with it. But I got together with these gentlemen. They're 9 men who came together and created this restaurant, which is like Caribbean fusion food, very nice environment. But I pitched this idea to them and they were like all for it. And we've done it twice before. We invite all men. Obviously, we want women to come because sometimes we have to drag them in, right? And so the idea is to, I'm not promoting alcohol or any of that, but we are saying let's get them in the environment where they're comfortable so that they're able to receive the information and talk amongst themselves. A lot of times the uncomfortability is, and especially men have said to me about colon cancer, why they don't get screened is because there's this homophobic idea that they have. Yep. And they just can't get past it. They don't get their prostate checked because they can't get past that. So Dr. Ileana Shapira has attended one before. I miss her dearly, but she was the one that was very real, took the coats off the doctors, no stethoscope and white jackets. You're just gonna come and listen. And doctors were stunned that men did not know the difference between their colon and their prostate. Wow. So it was really an educational forum, but where they could be comfortable saying that without feeling shamed and embarrassed. So that's why I love that event. And we had a firefighter come in to give, because at the same time I was doing Lights of Hope for American Cancer Society, and he was a survivor. He never told his engine company. And that was an environment where he came in and shared, and his brothers were like, what? You went through that alone? So moments like that, when it happens for men, women, we share all the time, but that means a lot to me, and just getting them to take one step, even if it's getting a GI doctor. Maybe you didn't get the test, but now you're checking in with the doctor based on these symptoms. So we're looking forward to doing it again in March.
Yeah, absolutely. Carlene, you have a question?
Yes, I do. So now that you've done the Jumpstart vegan or vegetarian plant-based diet, are you still going to keep going at it? Or
I did. I couldn't believe it. I mean, I got an Afro-vegan book, a cookbook, which was that was a surprise to me, in addition to the Borough President's book. And then it was just so fun to try all the spices. I was talking to Dr. Straker as well. She shared a few recipes, but it's very calming. I love to cook. And if it's gonna keep me healthy, why not? I've gotten a few of my colleagues interested on jackfruit, how to make barbecue jackfruit taste like pulled pork. Listen, don't play with me. I can already cook.
That's new.
Yes.
So I've been vegetarian for a while, I've been trying to get a lot of Caribbean Jamaicans to do it, of course. And it's so hard, but jackfruit is one of my favorite fruits. I've never heard of barbecue jackfruit.
I never heard of it before this program. Never heard of it before this program.
I have to try that. If you could barbecue, you could jerk it. So there you go.
Oh, yes, let's jerk it. Yes.
So, Dr. Martella Rooney, I just want to add just a comment, and that is that part of healing in many instances is being able to give of yourself to others. And I believe that for Mr. Nathaniel, that is a large part of what really has helped her to be not only healed herself, but to be a healing figure to others. So I just want to kind of mention that because she just goes above and beyond what you would think anybody would do in her position. And before we get to the end, I just want to say again, thank you. And, you know, Dr. Martello Rooney, do your thing. I'm going off again.
Yes.
Lakia, are there any questions in the chat?
You're on mute.
Oh, sorry, you're muted.
Sorry, there aren't any questions in the chat. I wrote a note for folks to drop questions in, but no one has dropped any questions yet.
Okay. Anyone have any other comments? Or Lakia, you have a question?
No, I just want to thank Diane. She's always amazing and awesome. I love her. Thank you again for attending this event. I enjoyed your presentation, and I'm sure everyone viewing enjoyed the presentation as well. Thank you so much. Thank you for sharing. Thank you for letting us into your world and sharing your experience, because I think that's critically important, especially in our community, where they're able to see folks that have survived from instances like this. So as always, thank you. You're amazing. And I know I'm going to see you in the future very soon, because you're doing wonderful things in Brooklyn. And I know probably it'll be the world soon.
And it started with you guys, because you promoted that event. You promoted our launch at Brooklyn Borough Hall. So thank you. I'm indebted to Downstate forever.
Thank you.
That's great. Well, Diane, again, thank you so much for sharing your story. Thank you for participating in yet another one of our events. And we will definitely see you soon.
Always.
In person.
Always.
Yes. Yes, we're hopeful for in-person events coming back.
Please, God, please. I'm on 2 Zooms at once, like insane.
Okay, so next up is Carleen Lawrence. I'm going to give her brief introduction while she gets ready to share her slides. So Carleen Lawrence received her bachelorette nursing degree from Marlowe College. And then she followed that with a midwifery and women's health graduate degree from New York University, followed by an adult nurse practitioner postgraduate certificate. I came to know Dr. Lawrence when she was a nurse practitioner in our division of gastroenterology and hepatology. And after leaving us, she went on to get her Doctor of Nursing practice degree from Stony Brook University School of Nursing. And she is now the co-director and clinical coordinator of the Bridge Interprofessional Team and a clinical assistant professor of nursing at our very own SUNY Downstate Health Sciences University. This coordinator that she has become is part of a multi-million-dollar award from the Health Resources and Service Administration's Geriatric Workforce Enhancement Program. Okay, thank you.
Thank
Carleen,
you so much
for joining us.
Of course. Thank you so much for inviting me back, Dr. Martello Rooney. It's like old times again.
Yes.
All right, so so this is just a brief overview of the GI system, gastrointestinal system. The colon is you can see with the label is the brown tube that goes across most of the stomach, and that is where we're going to, most of the discussion is going to be about. As Diane mentioned before, so my presentation with Diane always dovetails really well. The cecum, which she mentioned where her cancer occurred, is the end near where that's closed. So it goes across, it starts there, and it goes across the stomach and down the other side, up and down, and then it ends in the rectum where poop comes out. This is GI, of course. The cecum is a closed end. So that's where the food comes in, and then it travels across and goes out of the body. So her cancer occurred in the cecum, and that's where most cancers occur. Okay. So true or false, the answers are here actually. So colorectal cancer is the second leading cancer killer in the United States. It's an equal opportunity cancer. Both men and women get colorectal cancer. It often starts without symptoms, as Diane said. You're going along and you maybe feel bloated and you just think it's a little bit of gas, or you have a pain and you think it's, it's nothing, but most times it has no symptoms until you have the rectal bleeding, which is a late symptom. And screening helps prevent colorectal cancer, which I'll get into a little more. These are some of the diseases of the colon. I'm not going to go into each of them. And again, where the appendix is the cecum. And you can see the polyps are over here. Diverticulosis, you might know some persons that have diverticulosis, that's pouching in the colon. And when it becomes infected, it becomes diverticulitis. But we're going to focus this presentation on the polyps in the colon. So colorectal cancer, CRC, is the third most common cancer in the United States. It's the second leading cause of cancer-related deaths in the United States. And colonoscopy is a standard procedure, the gold standard for screening for colorectal cancer. 25 to 30% of patients going for colonoscopy have poor colon preparation. So most of my presentation is also going to cover the dreaded cleanse that no one wants to do, as Diane mentioned before. And there are different kinds, but I am actually going to focus on the prescription strength go lightlies, which is an oxymoron because once you take them, you're not going lightly at all. So, so there are different kinds of cleanses that can be used, and I'm going to mention them each briefly, but I'm going to concentrate on the go lightlies. Risk factors for colorectal cancer that we cannot control. So our age, as we age, we develop different illnesses as we age, unfortunately. It used to be age 50 was where we started screening for colorectal cancer, but that has been changed to 45. And for African Americans, it never was 50. We actually were screened earlier because when we develop colorectal cancer and it's discovered, it's usually more aggressive and more advanced. The other thing about colorectal cancer is that if you have a family history of someone with colorectal cancer, if you've had colorectal cancer yourself, you're actually not screened at 45 either. Your advice to start screening 10 years before that family relative was diagnosed with colorectal cancer, to hopefully catch it before it actually develops into cancer. Race plays a part, as you said. African Americans and Eastern European Ashkenazi Jews have a higher incidence of having colorectal cancer. As I mentioned, personal or family history. If you've had polyps before, you're screened at a shorter interval, which I'll cover, because they can develop into cancer. Personal history of inflammatory bowel disease, and if you're inherited any of the acquired gene mutations, one of which is a Lynch syndrome. Other colorectal cancer risks that we cannot control, I'm not sure why, and I've tried to find some documentation, but night shift workers are at a higher risk of having any kind of cancer for some unknown reason. I think it's because of the disturbance in our circadian rhythms, where we're supposed to be asleep at night, but we're actually awake. And then a prior history of having radiation treatment, like for men that have had prostate cancer treatments, where they've had pelvic radiation. Risk factors that we can control, again, are weight. Being overweight or obese increases our risk. A sedentary lifestyle, not getting enough activity, not getting enough exercise. All we need is 30 minutes 3 times a week to not be considered sedentary. If you have type 2 diabetes, that increases your risk, because then you're also, the risk of getting type 2 diabetes is when you're overweight, so that you have a double cause of developing colorectal cancer. Smoking is bad on so many levels. It affects every major system in the body on an adverse level. And now they're saying that sitting or being sedentary and not moving around enough is the new smoking. So smoking is definitely one of the worst. Heavy alcohol use, eating a diet high in animal products, animal fat, animal meat products, non-lean meat or processed foods, frankfurters, as Diane mentioned, bacon, sausage, because they have the additives that cure them. So that also increases your risk of developing colorectal cancer. But these are factors that we can control. We can control our diet. We could increase our exercise, which also cuts down on our weight and decreases our risk of getting type 2 diabetes. We can control our alcohol consumption and we can change our diet. There's another, as Diane mentioned, the jump start into the plant-based diet. I saw it on the downstate email. There's another session coming up, which I plan to start. I just want new diet, new recipes. I've been a vegetarian for a while, but I want new recipes. So protective factors against colorectal cancer. Most effective is having a colonoscopy. As I said, it is a gold standard for screening, a screening colonoscopy. Lifestyle modifications, as I mentioned, increasing your physical activity, limiting your alcohol consumption, avoiding starting, or if you have started, discontinue smoking, tobacco use, cigar use. A lot of persons now are thinking that the alternative to smoking is vaping. It is not, because although they're thinking, because they're telling me, the young persons that I've seen with it, and I'm asking them, they're saying there's no tobacco in it, but vaping is not an alternative to smoking either, smoking tobacco. And there's no specific or proven, although there's no specific or proven diet to prevent colon cancer. So there's not an actual diet that you should follow, like this is what you should follow to prevent it. There's actually a diet that you could follow to prevent it from happening, but it's not recommended. It's not like out there in the literature, like this is the diet. So these are the eating recommendations, what you could eat to prevent colorectal cancer. As again, low in animal fats, low in processed foods, high in fresh, non-processed vegetables. So fruit strips or fruit bars is not the same as eating the actual vegetable or actual fruit. Another thing that persons have come to do is like, if something is good and more is better. So blending or smoothies is not the same as eating the vegetable, because you need the fiber. That's what you need going through your system to help you. So the smoothies and blending the product, you actually end up taking in more sugar, which again increases your risk of actually becoming overweight and developing colorectal cancer. So eating the actual fruit, when you're full, then your body tells you you're full, so you stop, so you actually don't take in too many calories. Fruits that are rich in fiber, whole grain cereals and breads, brown rice, beans and peas, legumes, which is a high source of protein. Phytochemicals such as flavonoids, polyflavonoids, and terpenes, which are food found, which are one of the essential nutrients that we don't get enough of, found in tomatoes, citrus fruits, berries, peppers, carrots, broccoli, cabbage. Water intake is most important. Juice is not a substitute for water. Actually, teas are, because most of it is teas, but juice is not. If you're going to have juice, make a quarter of your cup juice and then fill the rest with water. But juice is not a substitute for water. So we need water, at least 6 to 8 glasses per day of water in our bodies. Our body is mostly made up of water, so we need to keep ourselves hydrated. And once you're thirsty, you're already dehydrated. So you should just keep drinking throughout the day to prevent that from happening. This is one of my favorite pictures I found on the internet. I love this picture. So variety is a spice of life. So instead of restricting yourself to any specific diet or any specific foods, eat a variety of foods. a variety of fresh foods, lean meats if you have to have meat, if you are a person that still eats beans, make sure it's a lean meats, not fatty, as lean as you could afford. I actually do another talk on how to buy the foods the meats that you can afford that may not be the best and make them actually healthy. So this is eat a variety of foods, fruits, vegetables, plant-based as much as possible, and keep those in your diet. So this is actually, I just actually love this, love this picture. Medication and supplements that are suggested, so they're not recommended to prevent colorectal cancer, and it's dependent on your age and risk factor. So these were recommended before. Again, I went looking while I was updating the slide. I did not find any specific literature that says they're recommended, so they're just still suggested. Low dose aspirin, which is good on other levels, it also is recommended to prevent cardiovascular disease. NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, but then you have to be careful and not, again, if something is good, more is not always better, because taking too many of these could also end up leading to ulcers and other complications. As I said, ibuprofen, Motrin, naproxen, the Celebrex, which is a celecoxib, in the family of the like naproxen. Calcium is also good. We don't have enough calcium, especially as women. Folic acid, again, these essential nutrients that we don't get enough of in the food sometimes, is magnesium, vitamin B6, and vitamin D. They've also found that vitamin D is good for preventing so many other things, but we don't get enough. So get up and walk, exercise, get up from your desk and walk, get up from the TV and walk, get out in the sunshine. We get most of our vitamin D from sunshine. Colorectal signs and symptoms. As I said, no symptoms. Most persons don't have symptoms until it's too late. Abdominal pain and bloating and distension might be thought to be something else and not actually developing colorectal cancer. Changes in the quality, the quantity, or the shape of your stool may be an indicator. New onset constipation or new onset diarrhea. Anemia, which could be a sign that you have internal bleeding or bleeding in your colon, which Diane did say was one of her symptoms. Rectal bleeding or blood in the stool, again, is a late symptom. Feeling weak and tired from the anemia, from not having from the blood loss, and unexplained weight loss. So know the symptoms to reduce the risk, because as you can see from this, the longer you leave it in, the bigger the problem becomes. So the longer you leave it unattended, the bigger the problem becomes. So this stool, this is a Bristol stool chart. So when you say the shape of your stool, this is what, so if you have I've had patients that came to me and they're like, I go once a week. And other patients, when you say you go once a week, they think that's odd, but what is normal for you, what's always been, that is your pattern. If that changes, so if you've always gone every day, but then you change and now you're going once a week, then that's a problem to report to your provider. If you've been going 5 times a day and then all of a sudden you're going once a week, that's a change in your pattern. So it's not the amount of time. As a West Indian, as a Jamaican, we think we have to go every day. Not everybody goes every day, but that's always been their pattern. But if that changes, then that's something to report to your healthcare provider. So this is the Bristol stool chart, and the pebbles on the top, type 1, and type 2 would suggest constipation. Type 3 and 4 is actually what would be considered normal. 5 goes back and forth depending on how soft it is. It could be considered normal or considered diarrhea. And of course, we know watery, fluffy stool is considered diarrhea. So this is what we speak about, the shape and caliber. If you've always gone and did pebbles and all of a sudden now you're doing liquid stool, then that's something that should be concerning also. And now, as I said, most of the leading associations have changed the recommendation. It used to be colonoscopy. Your first colonoscopy, which is considered your screening colonoscopy, was at age 50, but for African Americans, it never was at age 50. We were always recommended to start at age 45, just because, as I said, when we develop colon cancer and it's that detected, it's always more advanced and more difficult to treat. But also in the back of that is that if you have that personal history of polyps or a personal history of having cancer, or you have a family history of cancer, then your risk is, or your age for screening is actually different. It's supposed to be 10 years before that family member or when you were first diagnosed. So this is the colon cleanse. The picture on the left is a stool, is a colon with stool in it. And the picture on the right is the after picture, is what we are aiming for after a colon cleanse. The colon cleanse I am going to present is actually on the Downstate website from the Division of Gastroenterology and Hepatology. It's a 2-day split dose cleanse. The split dose cleanse evidence research has shown that the split dose cleanse is actually the most effective. It's a day of clear liquids followed by drinking the prep and going to the bathroom. Shall get into. When you get the prescription and go to the pharmacy, this is what you get, and everyone is scared of this. So this, as I said, is one of the kind. So even on the website at Downstairs, this is in the lightlies, which I said is not really lightly at all. There's also movie prep. There's a Gatorade cleanse that Diane said she takes. There's also the, I think there's one with Miralax, and there's also another one with the Citroma that you could buy at the pharmacy, but I am presenting this one because this is what's in the evidence, okay? So you pick the jug up, there's a powder in there. Some come with flavor packets. From speaking to patients, they said the cherry and the others don't help disguise the taste, which is what everybody's scared of. The lemon packet is actually the best. So if you have a choice, ask for the lemon packet. So 2 days before the colonoscopy, we're advising you or recommending not to eat any fatty, fried, or greasy food. You should not be eating that in any case, but 2 days before your colonoscopy, you should definitely not be eating that. This is one instance where you're not supposed to be eating any fruits, leafy vegetables, corns, beans, or anything with seeds or nuts. Does anybody know why that might be? Why no corns, beans, seeds, or nuts? No? Because they could stick to the walls of your colon and not get flushed out, because the outside kernel could get stick to the colon, not get flushed out during the colonoscopy. And that would actually get your appointment canceled. So after you drink the prep and go through all that, then your colonoscopy is canceled. So 1 day before the exam, no solid foods all day. And my patients tell me I am going to die. No, you are not going to die. So you're going to be on a clear liquid, and you will survive. Everyone survives. So you're actually, the clear liquid that I'm going to show a picture of is water, is the first preferred. Although it says clear liquids, I'm not sure, no one could actually explain this to me. Coffee is on that list of clear liquids, but without milk or cream, and clear broth. Gatorade or Powerade, because you're going to be having a lot of bowel movements, so you want the electrolytes from the Powerade, Gatorade, or any of those sports drinks. No red or purple, again, because they could color the stool and look like blood in the stool. Strained fruit juices can be, so apple, white cranberry, again, no red or purple, most important. Lemon, lime flavored juices, or white grape juice could be used. Soda, I would not recommend soda. You're not eating. I know it's on the list. I leave it there just to say, do not have the soda. You will be full of gas and you'll be very uncomfortable. Kool-Aid or other fruit flavored drinks, Jello will be your friend. Jello makes you feel full. That will be your what would help you with the hunger pangs throughout the day. Hard candy, Italian ices, popsicles, but again, no red or purple flavors. So this is a clear diet. So the sports drinks, the water, iced tea, apple juice, Again, try not to have the soda, although it is here on the list. Broth, that is broth in the bowl right there. The Jello and the coffee or tea or anything else that looks clear. So clear diet is anything that you could see through. So you could look through it, you could see the Gatorade except for the coffee. You could actually look from one side to the other. So split dose, again, is a 2-day. As I said, the evidence research from the East has determined that the 2-day split dose colon cleanse has a better results than the 1-day regimen. Consumption of the 2nd-day colon cleanse actually should be finished 3 to 4 hours before your appointment. I'm going to go into that a little bit further down. So on day 1, the jug that you have, you actually mix that. You can mix it in the morning when you wake up. There's a powder in it. There's a line at the top of the bottle. You fill it to that line with water. Shake it gently till all the powder is dissolved. And if there's a flavor packet, you put it in. If you don't have a flavor packet, you could actually use unsweetened Kool-Aid, or you could use Crystal Light for flavor. And you, as I said, you tap water, bottled water, place the cap on, shake it till all the powder is dissolved, and you put it in the refrigerator. It's going to look like water once it's mixed. It has no color or smell. About 6 p.m. that day, so you mix it in the morning, you put it in the refrigerator. About 6 p.m. you're going to start drinking the cleanse. You could use a straw, you could put it on ice. The big thing about the prep is the taste. So everyone knows about that has had a colonoscopy says it tastes horrible, there's so much to drink. But as I said, patients have told me I have not had it with I've had it without the lemon flavor, and it was okay. It was the most, I mean, not something that's the best, it's a medicine, but it was okay. So if you use a straw, the straw places a liquid behind your taste buds, so you don't taste it as much. So that's where the straw comes in, and the ice also helps to mask the taste. So start at 6 p.m. You're going to start to drink a glass full, 8 ounces, every 10 to 20 minutes. But because of split dose, you're only drinking half of the bottle. So that night, from 6 p.m. it takes about 2 hours to drink half of the bottle. Once you get to half of the bottle, you put that back in the refrigerator. You could keep having clear liquids. So you could have your Jello, your ice pops, whatever was on that list. You could keep having all of that the night before. You are not going to sleep this night. So just be prepared. This is why it's called a cleanse. Keep yourself hydrated, keep drinking, keep taking the foods on the clear list. Sometimes we give extra doses of laxatives, so make sure that you're completely clean, depending on if you have a history of constipation or you don't go every day. So sometimes you may get 6 tablets of bisacodyl or Dulcolax. About 9 p.m. you would take those, all 6, one after the other, with any of the clear liquids on that list, okay? You are not going to sleep. So that's another thing a lot of people are not happy about, but that's the whole idea. You're going to be going to the bathroom a lot. And that's what you want to happen. And one of the side effects, good side effects, you'll lose about 5 pounds because all of that old stool that's in your system will all be flushed out. You're still able to take medications while you're on taking the cleanse. So 7 days before your prep, once you have your appointment, 7 days before, there's certain medication that you should stop. You should not be taking any iron, including multivitamins that contain iron. You could of course, take your heart and blood pressure medicines with a sip of water, even the day of the cleanse. If you're taking any blood thinners that you've been prescribed, get clearance from your medical providers to how to take those. If you can be off it for a day, if you can be off it for half a day. So get clearance from your medical provider about that. This is colonoscopy. So what you want to see when you go to the bathroom, so what's on the left, the picture on the left is what the gastroenterologist sees. What you see is a picture on the right. So that's a toilet bowl. You want to see clear poop. So after you go all night, you're going to see clear poop. That's a good cleanse. And the picture on the right shows that it's completely clear. There's no stool in the colon, and that's what the gastroenterologist wants to see. B is you can't get away with that because they do flush and they tried not to reschedule you, but you're aiming for the picture on the right. If you follow the 2-day cleanse, you should have that. C, your colonoscopy is going to be rescheduled. You're not going to have your procedure and you're going to be upset. You took a day off from work, you went through, drank the nasty tasting thing, and you still have to do it over again. All right. So try to aim for A, just follow the directions. This is a colonoscope. It's actually a camera with a snare. I'll show you the snare. It also has a jet, a water jet. So that's where, as I said, the gastroenterologist does try to flush and complete the procedure, even if you didn't follow the cleanse properly. So this is a camera. It has the light, the camera, and it has a flush, and it has a snare on the end of this. These are polyps. So they put the camera in, and the fibroscope camera in, and as I say, it goes up your rectum, up your colon to the other side. That's where your appendix is, where the food comes in from your small intestine. And they look on the screen, and this is what they're looking for. Hopefully we don't see. These are polyps. Polyps come in many different shapes and sizes. So these are polyps. These are pedunculated, the ones that looks like they're on the stem. Oops, I think then. So these, as you can see, if they do have the stem, this is a snare that's also in the fibroscope. They put it around like a little lasso and they cut it off during the procedure. So as I said before, colonoscopy is the best screening procedure for early detection of colorectal cancer. It's a screening prevention for developing colorectal cancer or for developing more advanced stages of colorectal cancer. The colon cleanse regimen is the most unpleasant part of the whole procedure. The actual colonoscopy, you can be put to sleep. You could be completely asleep, or if you're awake, then you get medication to relax you, so you're not feeling it. I've had patients that have gone through without sedation, and what they describe is that they feel the pressure of the camera moving through their colon, but they never said it actually hurts. So you could actually, there's some places that are trying to cut back on the anesthesia, and they actually will perform the colonoscopy with light sedation. Precancerous polyps, as I showed you before, the polypectomy are removed during the procedure. It's not like they see it and they send you away and you have to come back and go in again and remove it. The fibroscope has the little snare, the wire snare, and it cuts it off as much as possible during the procedure. The duration, although it looks like it takes forever, it's about 30 to 40 minutes. And then if there are no polyps, or if there is a polyp and they send it to the pathology and it's negative, it's not cancerous, then depending on your family history again and your personal history, the follow-up is in about 5 to 10 years before you'd have to repeat a colonoscopy again. So this is it. If you have to have a colonoscopy, sit back, prepare. This is the best bathroom I've seen at preparing you for a colonoscopy. They're set. They're right there. They don't have to go anywhere. I'm thinking on the side, they probably have a little refrigerator, right? Any questions?
I just wanted to reinforce your statement about the medication, especially for people who have hypertension, because the what they will be drinking contains so much salt that it could elevate things. So I just wanted to double down on you need to take your medications.
Yes, you do. So the medications, as I said, you could take them the day of the procedure with just a sip of water. So the day of procedure, the night before, you can have as much clear liquid as you need, but the day of procedure in the morning, you can take your medications, but with a sip of water, just enough to swallow the pills. But yes, and it's except for the blood thinners, which you have to clear with your provider, your healthcare provider, you should be able to take most of your medications. Yes, your heart medications and your blood pressure medications.
Lakia, are there any questions in the chat?
No, there aren't.
So Carlene, I have a question for you.
Sure.
So with the recent death of Chadwick Boseman, I think that really highlighted this new kind of information regarding the fact that there has been shown to be an increase in those diagnosed with early onset colorectal cancer. So we now have, kind of a push to study this more closely. And I just wonder as you being a nurse, how do we focus our message on this younger population that is probably not thinking colon cancer, could ever be a factor?
So actually downstate before COVID, we're BC, before COVID, we were actually going out in the community for Betty's department, which is excellent department. We were going out in the community and speaking to persons where they live. We went to the health fairs, we went to the churches, we were going to the schools and presenting it there on the local level, where we're face to face and able to answer questions, going off to the side and answering personal questions, and somehow reaching as I said, where they live. I think that was the best way, and the best way to continue. Hopefully PC post-COVID will be doing that again. Unfortunately, the death of Chadwick made a lot of persons sit up and think, because he was so young and he looked perfect. Like Diane said, nothing was happening when we just saw him, and then days later we heard he had passed away. I think that did focus on persons' attention, especially males that have that homophobic, because when I've presented it, they're like, no, I'm not having that. No one's touching me there. So that did focus for a lot of males that they should go and have it checked out. Their wives bring them in kicking and screaming to have it done. But the best way is to just, even like with the COVID vaccine, is to bring it to the community, bring it to where they live and break it down for them where they could actually interact and ask you questions.
Yeah, I know that in the past, one of the avenues by which we've been trying to disseminate different messages has been at barbershops. So I wonder too if, kind of including that as one of the messages in one of these barbershop, studies may also be another way in which we can now raise kind of really this concerning issue where there are more younger people being diagnosed with colon cancer, certainly under that 45,
definitely
age for the start of screening.
So my the research I did for my doctorate, I actually developed a YouTube video, which I which was the point was to bring it out to the community, because everybody goes to YouTube for everything. This is why I decided to stay on the lightlies, because on YouTube, when you go, you see the other kinds of prep that most people want to see. They don't want to do the go light. They don't want to do the 2-dose. They don't want to take the nasty tasting stuff. So when they go on there, I figured they would actually see someone that looked like them, hopefully from our community, explaining it. I'm not sure how to reach the males. If the death of Chadwick Boseman hasn't done it, I'm not sure how to get past that homophobic fear of the males. But that's something we need to address really in the community. As far as the younger persons that are at risk, I think that again, it has to be someone famous. Unfortunately, they listen to the athletes, they listen to the celebrities more than they listen to us, the healthcare providers. I'm not even sure how to reach them at this point. Even with again, back with the COVID vaccine, as you could see, they're so resistant to that. Unless someone comes out, I think the most effective thing that's happening right now, I think, is it not Shaquille O'Neal, I keep forgetting this. LeBron is on board with the COVID vaccine. Someone like that would have to come out in favor of it, a male, and I think that would be the best advertising.
Yeah, definitely. I think, you know, if we can just keep these messages going out into the community, I think that's the only way to, you know, get someone who all these symptoms that, you know, Diane referenced, you know, who may all of a sudden have these changes that you referenced.
Mm-hmm.
You know, this is the way to really get that message out there.
Yep.
Lakia, were there any other, or were there any questions in the chat? No.
I think we did just such a good job. No one had any questions.
Yes, you
agree.
both were so thorough.
Yes.
No one had any questions.
No, I think probably the only other thing I would ask is, you know, I think for patients that are underinsured or uninsured, you know, what are the options for them to, you know, get access to colon cancer screening?
That has always been a problem. I think the unfortunately the county, the city hospitals have captured that audience, that population, because they have the payment plans. I hate to say here at SUNY Downstate, having worked in GI and seen patients that have come in without certain insurance that we accept, or no insurance at all, is actually really pricey, sometimes pricing them out of having the procedure. We usually refer persons to go across the street to Kings County to have it done, because they have a payment plan. We stress the fact that they should follow up. I actually had, before, I know you know the NP that was in my position before me, I referred them to her, to Juliet across the street. Yes. So I refer them to Juliet across the street, and she takes care of them. But it is really sad that you need insurance to have this procedure done in certain hospitals.
Right.
Yeah.
Yeah, I know that Betty Young, who, you know, was assisting us with organizing this, runs the cancer services program here at SUNY Downstate, and that will support patients with getting the FIT stool test.
That's true. There was issues
And
with that also.
If that is positive, then it will give them access to the diagnostic colonoscopy. And
but
so
even there was a catch, because I've had, that's how I actually met Betty, is when she brought me her patients. They will not, the grant she had at the time, I'm not sure it's changed, would not pay for sedation. So that's where I met patients that had colonoscopy with just light anesthesia. And actually they said it wasn't bad. And it seems like it's a horrible thing, but a lot of hospitals are now, healthcare facilities are now moving toward not having sedation and anesthesia, where you actually go completely to sleep before colonoscopy. So I guess a cancer society was ahead of their time. Yeah.
well, yeah, I think, yes, go ahead.
It's funny you asked that question, because a friend of mine just asked this question, and I did speak with Betty, and she did give the other option, which was to apply for emergency Medicaid. And you can do that directly at Kings County. Issue is you have to wait to be approved, and then you can go back and it is covered. Or if you see rectal bleeding, you can apply for a different type of emergency, which will give you access, and then they will bill you.
Yeah, but also again, that leaves out the undocumented persons also.
Yeah.
So that's the other thing.
Yeah.
Yeah. So that's just the other way. Kings County or any of the city hospitals.
Yeah, that's great. That's a great point. That is also another option.
There's actually a workaround. Are we still being recorded? There's actually a workaround so that we've actually had for patients to get the procedures that they need. So we would send them to the emergency room, because you know, once you go in the emergency room, you get everything you need, and then you pay after the fact. So yeah.
Yeah, I think, I mean, obviously, if you're experiencing rectal bleeding, you know, it's most critical for you to get that procedure done.
Yes. Right. Yeah.
To address it. And it's really unfortunate. This still bothers me to this day that Diane went literally a year misdiagnosed. And, you know, I wonder if, you know, she was diagnosed with stage 3, would it have been only stage 1 or 2 if she was diagnosed, you know, right at the moment that you might have suspected this could have been colon cancer.
Yeah.
And you know, one other thing, Dr. Rooney is who educated me on. I was diagnosed with the H. pylori ulcer probably 3 or 4 years before I was even diagnosed, and no one ever told me that was a precursor to colon cancer. I had no idea, and I had it twice.
Oh wow. Okay.
I was on that medication for 6 weeks, and then the second time it was 3 months, twice. So no, just really not really connected. Everyone was really focused on age and
The
not
age.
being
Right.
the age. Yeah, not being the age.
Absolutely.
I think that should be part of our messaging, is not the age, it's the symptoms. Like, what are your experience? Like educating persons on the symptoms that they're experiencing, as the change in the bowel, the bowel movements, and instead of just focusing on the age.
Just the age, absolutely.
Yeah, and I think, Diane, too, your message that you have to be your own advocate.
Yes.
And you have to be persistent, especially when you know, your message doesn't seem to be being heard. That, you know, you can't give up, because it's your life that's really at stake in your case. If you had given up, you know, would we be talking with you today? And so, you know, that is just so critical for people to really be their own advocate.
Yeah, I agree.
Especially in our community, that's the other thing. With my patients, I stress for them that you have to advocate for yourself. I don't like when patients, I ask them a question and go, whatever you think. I'm like, no. It's your health. I'm giving you options and I'll help you to make a decision. But at the end of the day, I want you to make a decision. Yeah.
And I think it works both ways. One of the things I just shared on the Cornell talk was, I won't name any spaces, right? But I have heard from patients as we move through advocacy on the grassroots level that people don't feel comfortable. Sometimes they feel like they're being spoken to in such a disparaging way that they don't want to follow up with that place, but that might be the only place I can go. So if I'm unemployed, have no insurance, I have to go to Kings County. But at Kings County, they're treating me in such a poor way. Where else am I going? Right? Because you can't go to NYU with a complaint that Kings County didn't treat you right. So people get really discouraged easily, you know, because it's already a fearful thing to have to go and do because you're afraid of what you're going to find out. So then to have somebody top off some more stress, you know, and most people who are sick have been stressed out. Nobody wants to be sick. So I feel like sometimes people who unattend to their health, either single moms with all these children and working really hard, 2 and 3 jobs, still trying to go to school. You know, people have very stressful lives living here, especially in America, but particularly New York City. And if you live in Brooklyn, you are working 3 jobs to pay your rent. And it is very hard. Like, we need the medical community to work with us as partners and patients, like, because you'll be a patient one day. And if you ever got this care that you were providing that was not nice, it's gonna be a problem.
Yep.
I just hope that people know, still go back. There are places you can make a report about how you were treated, but the last thing you're gonna do is not get treated.
Yeah, that is true for a lot of our community. I don't, it's not passive. For me, as a Caribbean and West Indian person, we have physicians, healthcare providers in a high regard, and they will not speak back. Even if they feel disrespected, they'll just not go back. Yeah.
Mhm.
Yep.
Yeah, they would rather not go back.
So yeah, that's part of my mission, is to teach my people how to advocate for themselves.
Awesome.
To believe that they're deserving of this care. I mean, especially if you're paying, even if you're of this
That's
care, and
right.
if you're not pleased with that provider, trust your instincts and find another provider.
Right. Healthcare is a right, not a privilege. And that's how folks treat it, right? Like this is, we got to vote on this. It's sad. It's very sad. And as we move through COVID continuum, you know, I don't know, part 3,
that's another whole talk.
I mean, we're just fighting with the mayor. How dare you? I'm in an elementary school. My students can't be vaccinated. So you decrease the testing? What? First, we didn't have any on-site testing. Then it was bi-weekly. We had to fight for weekly testing. I have 1,000 kids in here. Are you kidding me? So if we didn't say anything, y'all, guess what we would have right now? A super spreader event. Trust me, you know? So they were here this week to test, and they're only testing 10% of our population. But that's for like everything. We're always cutting corners to give the Black community the least. And it is like, this is not happening in the private schools, Brooklyn Friends, St. Anne's, and all these. It's not happening in those places. It's not happening in Park Slope either, right? In a public school. So we really had to like turn it up and say, no, that's not happening. That's not happening. So we did get one thing, but I mean, at the end of the day, it's being an advocate is difficult. It's like Carlene said, people hold physicians in the highest regard because we're raised to under it. Teaching and education has to come through teaching and education. You will not be a doctor or anything with a person. So I don't understand like the level of how the hierarchy of what we respect in our purview dictates our actions and behaviors. And so for sure, when you walk into the doctor's office, you're right. No matter how they treat some people, they take it and they're like, you know, that's what my doctor said. And so I'm going to keep going, you know, or I'm not going to go back.
Yeah. Well, I think this was an amazing first lecture for our community lecture series. I'm so thankful for Carlene and Diane to have joined us and given us, you know, really important messages about colon cancer screening. You know, it's really the only cancer screening test that will find, you know, precursors of cancer and actually remove them at that same screening test.
At the same time.
So it really, you know, as many people as possible that can take advantage of that test, you know, we want to get that message out there because it really is a one-of-a-kind test. There's nothing else out there like it. So I think both your messages were excellent. And again, I want to thank our sponsors, Cold Spring Harbor Laboratory and Northwell Health. And of course, my partners in this, Pam Straker and Lakia Maxwell and Betty Young, who I don't think was able to make it tonight. But yeah, thank you. I appreciate you taking the time to kind of walk us through the, you know, reality of colon cancer screening, and Diane giving us, you know, a firsthand story about someone who was under the age of screening. And, you know, this is, I think, you know, the example like with Chadwick Boseman, you know, with an increase in earlier age, you know, we really need to also get that message out there.
Thank you all so
Thank you.
much.
Yes,
And we
thank
will see you
you.
next time.
Thank you.
Thank you for
Thank you.
inviting me.
Bye.
Take care.
Bye. Thank you.
Yeah.
Have a good
Thank
evening.
you.
Bye-bye.
Bye-bye.